Krishna Sharma. Today we're going to be talking about how fertility clinic success rates should be interpreted with Alpesh Doshi, consultant embryologist for IVF London. Hi Alpesh, how are you?
Hi, I'm good, Krishna. How are you?
Very well, thank you. So before we get into success rates, what in general makes a good fertility clinic?
So this is a very important question, Krishna, because how should patients choose a fertility clinic? And I've done an episode in the past whereby I've highlighted some very key important points. And I'll reiterate them. One of them has to be the location. You've really got to be comfortable with how close the clinic is to where you stay because of the multiple visits that are needed during an IVF cycle. Of course, the comfort level of the patient with the staff is also very important. Ideally, you want to go to a clinic where you'll have a very personalized and bespoke care. You want to be seen by the same doctor every time if possible, because there's continuity of care there. And of course, as I'll explain later, this all impacts in the success rates as well. So location is very important. The skill of your doctor and your embryologist is very important as well. And of course, your comfort level as a patient with the staff at the clinic.
And so how do these criteria all filter down into a clinic's success rates?
Again, a very important question, because we say comfort, skill. How does this really translate into success rates? So the comfort is when the stress levels are managed. Of course, we want to make sure that the patients are relaxed when they're having treatment with us. And when they are relaxed, when they understand every aspect of the treatment, they're very better informed, which means that they are equipped with all the tools to manage their questions and their emotions. So the emotional support, all this really matters during an IVF cycle. Our regulators also put a lot of emphasis on emotional support nowadays. Secondly, as I said, the skill of the embryologist, the skill of the doctor, cycle monitoring, what protocol the doctor uses on the patient, whether they're using the long protocol, short protocol, what drugs they're using, what dose of drugs they're using, whether they're using a mild stimulation approach. We know for a fact that women with a very low ovarian reserve may benefit from a much milder approach at stimulation rather than pumping them with a very high dose of stimulation, which will ultimately affect the quality of their eggs and potentially the embryo quality as well.
So there's a big focus on personalized care.
Absolutely.
Right. And there are lots of different types of success rates that are reported by fertility clinics. Could you explain what they all mean and how they should be interpreted and how we know they're regulated?
Correct. So all clinics are supposed to be transmitting their data to our regulator, which is the Human Fertilization and Embryology Authority. And the authority does publish results every year. Now, it's a very good question that how are these success rates measured? So the authority measures them in several parameters. One of them could be per cycle started. So whenever someone starts with fertility drugs, that's a cycle started. Or it could be measured per egg collection. So there will be some women who may not make it to egg collection despite starting the drugs. So the denominator changes. The egg collection then becomes a funneling measure. Then it could be per embryo transfer. So we all know that the journey of IVF includes collecting the eggs at egg collection, fertilizing these eggs, creating embryos, and then there will be an embryo transfer at the end. So it is the pregnancy rate per embryo transfer. It's the procedure. And finally, and the most important measure in my opinion, and obviously our regulators feel the same, is pregnancy rate per embryo transferred. So if a clinic is putting multiple embryos in each event of an embryo transfer and continuously gets just a singleton pregnancy, then the pregnancy rate per embryo transferred may be lower than a clinic that continuously puts one embryo back and still manages to attain a very high pregnancy rate. So in short, the pregnancy rate per embryo transferred is a very important measure of success rate of a clinic.
Thank you so much for breaking that down for us. Do you have any other resources that audiences could use?
Sure. It's also very important to get validated statistics or success rates from the HFEA website. So as I said, the HFEA publishes this every year, and if you go onto the HFEA website, choose a fertility clinic, all the statistics should be broken down, which are validated by our regulator, the Human Fertilization and Embryology Authority.
And more information, I think, is available on the IVF London website in interpreting data?
Yes, how to interpret success rates. So everything we've talked about today is also on our website.
Perfect. Thank you so
much.
much.
If you have any further questions, you can reach us out at info@ivflondon.co.uk or visit our website or connect with us through our social media handles. Thank you.